like the huge heterogeneity that we have in the e-cigarette market, 8,000 products, whatever the number of products there are, and that's something that brings the question is, what is that going to do? What is that heterogeneity in product availability, in liquids, in their effects potentially is going to have? And that's something else where modeling might be able to have an important contribution in trying to understand what is that heterogeneity going to do to the health outcomes of e-cigarettes in the long term. So I'll stop.
So we'll open for questions from the committee.
So I think the modeling area is very important, but it also raises the old computer adage, garbage in, garbage out. And the concerns I think we have is there's so much that we don't know yet about e-cigarettes. That's the garbage in part that I worry about. What would really help us is to hear from you, and perhaps even in writing afterwards, is what are the key missing pieces of information that because what we can do is recommend research agendas as well as what we think the science says now. What's missing? And I think that helping us to really narrow in on the key points that will be necessary to improve our understanding of the impacts, especially things like smoking cessation and the value of this in the long run, will really be helpful. So I'll just throw that out in general in terms of identifying 2 or 3 really key pieces of information that you think are sort of the weak links for modeling.
I tried to very briefly summarize it on one of my slides, and I think what's very important is we need to know the transitions and transition probabilities. That is crucial, and those we are trying to assess as we move into the future. The second piece of information that you would think would be fairly easy to get, but is also very difficult to get, is mortality rates by smoking and former smoking and age. It's almost impossible to find those that are stratified by all 3 factors. And finally, the excess risk of the new product versus cigarettes, I think, is the third big piece of information. I think if we had those 3 pieces of information, we could do a lot.
Yeah, I want to mention that CISNET has developed mortality rates that distinguish by current, former, and never smoker, and by age and gender. So those can be used. But again, I think the important thing is not to jump to conclusions until we have better measures of use. We need to get measures that are predictive, that have been validated. Right now, when I read another paper, and I immediately discount it if they come to a strong conclusion that they're explaining the world in any way. Until we have good measures, we don't explain the world. And so the important thing to keep in mind, and that's why I emphasize, modeling at this point, it is largely garbage in, and I wouldn't disagree. I'd be the first to agree with you. And as a result, we need to look at that. Now, something else that I think is important is to look at the products that people are using and the transitions related to that, because, I learned a lot today about how those transitions appear to be different depending on what product you start with and so on. History here is really important. Qualitative studies are important. They provide us the insights, but then we need to look at the data to look at actual transitions, and PATH has a lot of that information and is slowly but surely, I think, coming available, and that's where we're really going to understand, I think, ultimately what's going on.
I also feel that David is right that it's impossible to come up with exact predictions, but I think what we can do is, and what we have done, is say, let's go with the extreme. So, for example, it's extremely unlikely that half of all people who would have never smoked but start the alternative product, that half of them will switch to smoking. Now let's put that in. It's also very unlikely that 3% of people who would have never smoked in their life, that 3% of those people initiate the new product in each age category. So this is about as extreme as you can get. And then we do our tipping point analysis. And we say, so how much of a beneficial effect do we have to see? So if we find that, actually switching from smoking to the alternative product, you don't need all that much to balance the scale again, or maybe even tip it the other way, then I think we have valuable information. We can't come up with numbers, but we can determine if it is likely that there would be a harmful effect, no effect, or a beneficial effect.
Two quick comments to add on. So I agree with the categories that they've laid out, but a further specification is we need to be careful with our terminology. Is a current user an experimenter? Have they used 100 cigarettes? I mean, and what does it mean in the ends world? I think Dr. Levy had on this. Does that paradigm still hold? That's something that even at times can be tricky with cigarettes getting the right data. The other aspect is sometimes prediction is your goal. And even if it's a garbage answer coming out, the process of going through the modeling, understanding what are the various mechanisms that could happen, can be informative and can be useful. So it's great when we have a number that we can go to the bank with afterwards, but from a modeler's perspective, really understanding the system is a value in itself.
So one question that I have about the population health modeling, I hear talking about individuals that are making a decision of either quitting smoking or changing into electronic cigarette or some sort of other nicotine device. We know that people that make lifestyle choices, for example, quitting smoking, there are also other lifestyle choices that contribute to poor health. You could have somebody who's addicted to substance abuse, alcohol, lack of exercise, diet. So when somebody makes a decision so fundamental as to either quitting or switching into something that is perceived to be safer, very often some of these individuals, they also make some other modifications in their lifestyle. When does that come into consideration into the modeling? Because it could have a tremendous impact into what comes out of the modeling exercise.
To my knowledge, it doesn't come into the models, or at least none that I've seen so far. But I think that is an extremely important question. The people that are left smoking, by and large, are poor and have mental health issues increasingly. So we need to untangle those effects. With being poor, often comes is a greater likelihood of poor nutrition and various other issues. So we will need to start untangling those effects better to really fully understand things. But this is a problem. This, it's related to e-cigarettes, but it really goes back to our understanding of even the risks associated with cigarettes. And something that I think supports what you just said is if you look at the estimates of total mortality risks over time, you'll find that there's almost a 50% jump in what came out of CPS 1 and 2 and what's come out of the recent studies. It could be due to a number of things, but one of them probably has to do with diet and these other risks that you talk about. So these are very important issues.
So maybe just to add, I'm sorry, just to add one thing, that I mean, these are population models. So unless you're getting into like modeling individuals one at a time, what they do, which some models might actually do. In general, we're thinking about like large-scale U.S. Level, maybe states type of models, where the transitions are population. Where you can actually capture some of these effects would be in the mortality rates that were mentioned. So for instance, in CISNET, that David Levy and I are part of, we're developing mortality rates that are trying to account not only for smoking status and gender, but race, socioeconomic status measured as income, measured as education. We haven't got into, for instance, mental health, but that's really a critical factor. But at some point you have to stop because you're not going to have like the bandwidth of getting into those very important issues, but that just these models won't be able to address. But certainly some of that is we're going to be able to deal with by having better mortality rates, relative risk, which is, I think, the general consensus. That's probably the main missing piece of information right now, and as it varies in our groups as well.
I just wanted to add briefly that if you get your mortality rates from your population of interest, then if you have mortality rates among former smokers, those former smokers are like the former smokers in your model. They may have made other lifestyle changes too. And so that is already incorporated in those smoking rates among former smokers, but those rates have to come from a population that is representative of your study population.
So I want to bring this question for all of you, and that's something that, pretty much all of you have alluded to, but suppose that we have a specific problem to solve. Let's say we want to know differential mortality and prevalence by the year 2050, right? That's a specific issue. How would you use models to prioritize? It can be any goal, it doesn't have to be that, but a specific goal. How do you use models to prioritize and identify the data or the information that you need to gather? I mean, there's a myriad of information. How can you use the model to distinguish what is important and what is less important?
In 5 minutes.
So briefly, sensitivity analysis is one of those great mathematical techniques where if you've got a computational model, frequently involves running it a bunch over a space of parameters, and then there's techniques where you say, this one, the variability in the outputs is most due to, and sometimes you can order them in a ranked order. So that's a great technique that frequently as modelers we like to use.
I completely agree. So one of the things that you can do with the model is simulate and then look at how your outcomes vary depending on the parameters in your model. Of course, it depends what parameters you put in your model. But maybe just wanted to go back to the example of that paper. We look at the effect of E6 on adult smoking prevalence, where we varied the effect on initiation and varied the effect on cessation. And basically, we have no idea where the effect is, right? But we plotted a heat map and said, this is how it would look depending on what the value is, and identify that the critical parameter was cessation, right? So if you ask me right now, if you wanted to look at adult smoking prevalence and say, what's the effect going to be? The main priority is, for instance, to look at what's going to be the effect on cessation, and on a lesser matter, on initiation. Now, going back to the first question, why did we model adult smoking prevalence? Because youth smoking prevalence is really hard to understand and define, because let alone for E6 for smoking, defining use, it's quite complicated. In that model, for instance, our analysis, we didn't model mortality, and one of the reasons was, well, we don't know what the effects of E6 are going to be. So we didn't want to get into that specific discussion. We decided to make a very limited analysis that was looking at very specific outcomes. So again, that's another example going back to David's question in terms of you can use your model to help you gauge, if I have to pick between this and that, what would I pick in order, because it's the most relevant parameter. So.
But take some care in figuring out what your key analysis question is. Because if your question is, What parameter is it most sensitive to in 2020 versus in 2050? You may get a different answer.
And, yeah, I would agree completely with what's been said, and I'll just add one other quick thing, and that is, I think we need to start paying more attention to differences by SES and other product use too. And what's very important here is smokeless, especially when you consider that smokeless tends to be higher among whites, as is e-cigarette use. We need to understand what that's all about.
It's my turn. This ends our very long day. We ended up only being 15 minutes behind, which is pretty good for everything we heard today. We do not have time for the public comment section. If there's anyone in the audience or virtually or in the room who would like to send comments to the committee for their consideration, you can email them to me or Alexis, and probably all of you have those email addresses. Alexis is on the web, and those of you who were speakers have mine. And we will give them to committee tomorrow and read them and consider them, or at any time afterwards, so please do that. Thank you to all the speakers. I thought a round of applause for everybody. I thought it was great. And to the committee, your chair has asked that we retreat to our original room for just a little bit after this, so don't linger too long. There's just lots of fun going to happen next door.